Hey there. Hi, friends. Happy Wednesday. It's been really fun for me to get to hang out with you all on Wednesdays and chat and catch up because, oh my gosh, Marlee's here. Yay. So excited. It just helps to mark the passing of time to have something weekly that I get to do with you all. Cannot wait for tonight, you guys, because Marlee, I have a bit of a girl crush on. If you don't, you will after this. I'm convinced. She just became a doctor, just got her MD. And we're going to be talking about everything from what it's like to be a fat girl in the doctor's office as a patient and as a doctor and everything in between. So I think it's going to be really fun. I'm going to pop Marlee in right now. No. Marlee, on your end, if you can try to request to join. So on my end, I'm not able to pop you right in. For some reason, it says unable to join when I try to for you. But hi, everyone. Hi, Regina. Great to see ya. Hi, Jameson. Hi. Hi, everyone. Oh, sorry for turning that around. Now you saw a big bag of dog chow. That's fun. And hi, MSD Visuals. I believe that you're Marlee's boyfriend. So nice to see you. Okay. Marking us right now. Hello, PCO Jess, my girl. Nice to see you. Hi, Marlee. Oh my gosh, it's so good to see your face.
You too. How are you?
I'm good. Oh my gosh, how are you? How does it feel to be graduated?
I'm good. It feels really good. Still pretty surreal, but yeah, really good.
Yeah, I can imagine. So how many years has this been coming?
So, okay, it's always different when I explain it to different people because the starting point can seem different. So, okay, so I did high school, graduated high school, then I did 4 years of college, and then 4 years of medical school. And that's exactly where I am right now. And then I personally will do 3 years of residency.
Okay.
And then maybe more, but that's like the absolute minimum that I need to do to be able to practice on my own.
Okay. All right. Hi, Maggie. Hi, friends. So that's okay. So you are high school, college, 4 years, and then you're going to your residency starting when?
So I'm moving in a week.
Oh my gosh.
Yeah. And then I start orientation June 15th, but we're not totally sure how much is going to be virtual, how much is going to be in person. And then I start in the hospital July 1st in the ICU, but non-COVID. So that's
okay. How are you feeling about all of it? Are you nervous, scared, excited, all of the above?
All of it. I'm mostly excited, I think, more even than I would be otherwise, just because I've been inside and not exercising my brain not even just with the pandemic, but even before that, 4th year of medical school, it's different for everybody, but it can be the end of it tends to be a bit of a wind down, which is awesome while it's happening. Oh, one of our residents is here. She just waved. And also thank you to everyone that I know and don't know that tuned in. But I don't know what I was saying.
You were talking about how the bit can be a wind down.
Yeah. So even just my last month was a vacation regardless of the pandemic. And then it was kind of nice because at least when we got called off of rotations, I didn't have to make anything up online. So I really haven't done inpatient medicine in at least a couple months, and some of my classmates probably even more.
Wow.
And so I think people get nervous about just feeling like, oh, I've lost all of the information that I learned over the last 4 years. It sounds like that's not the case. Everyone just sort of tries to appease you and be like, don't worry. It's okay if you think you know nothing when you get here. We will help you. But you do know things. So I'm trying to help that.
But yeah, I can imagine feeling rusty. And so the fact that you haven't been doing inpatient care the past couple months is just due to medical school, not the pandemic.
It's a little bit of both. I got called out 2 weeks early because of the pandemic, and it started off, it was like, oh, we're postponing rotations until X date, and then it kept extending, and now the other medical students that haven't graduated yet are still on hold for another couple weeks. I think some of them are starting in a little bit over a week, or they're supposed to. That could continue to get extended. But yeah, so I would have been off my last month. Some people, you can get, for my school at least, you get 2 vacations months in your like 4th year. And so I bookended my year. So I did one at the very beginning and one at the very end, which
Okay.
I highly recommend if anyone is a med student watching.
I love it. Oh my gosh, you have so many fans. I think this is your boyfriend tuning in here too. Between 2 stethoscopes, that's an amazing handle.
The neuro PA, she's amazing.
Yay! Oh my gosh, and I love that you're drinking some wine right now. I
Yes,
weirdly
okay.
didn't grab one, but I have
just,
a Coke.
It said pour a glass, and I was like, all right, let's do it.
Yes! Oh my gosh, I'm mad that I didn't. Let's cheers.
Happy Wednesday. It's Wednesday, right?
Yeah, I think so.
Okay, I have to shout out Jess really quick because she just commented, and she's the reason that I'm here right now. So thank you, Jess, for writing to you guys and saying nice things about me.
Absolutely. I mean, absolutely. Thank you, Jess, for introducing us to Marlee, and also just for, she is always here to hang out with us. She is here. She's our biggest cheerleader. I'm sure she's probably the same to you. She's fantastic. Oh, I love it. Well, how did you like get started? What made you think? I know we kind of posted some of these questions and answers already, but like, what really got you thinking medicine was for you? That's your career path.
Yeah. So I like wrote my whole medical school personal statement about all of how it was like not one moment and it was a series of moments, but
Sure.
It really was. So I think the very beginning was my dad was in a pretty bad car accident when I was in kindergarten. And so he's pretty severely brain injured still. He knows who we all are. He's very loving, very supportive, but he can be very anxious, impulsive, and he has some physical limitations as well. And so really his whole recovery got me fascinated with the brain and just also introduced me to the healthcare system really early. And so I think it was always like, it has always felt like that was a big driving force, especially because for a long time I thought I wanted to be a neurologist. So I know like as far back as in middle school, we had to pick a language to learn, and I picked Latin because I was like, oh, there's a lot of medical terms in Latin, which also further back and still learning, choose Spanish. But that's separate.
But that's how early your mind was made up that you wanted to do medicine.
Yes. And I just sort of continued to have things that would validate it. So then in college, I studied neuroscience, and I was like, oh, I love, I just saw Bree said, we just missed you, that I almost did neurology. So the way that sort of shifted was when I got to medical school, I was like, oh, I do love neurology, but I love all the body systems, and I don't want to really neglect any one of them. And in most fields of medicine, you do still try to deal with the whole person, or at least you should. But I think for me, I realized that I really cared about the social aspects of medicine and how your environment affects your health. And I think family medicine is the place where you can do that the most. I feel like I'm on the interviews again. But yeah, so I think that's really the main thing. And then I did also struggle with some chronic illness in high school. And I think although the medical field didn't necessarily do anything so big to get me out of that, it was kind of the thing where my primary care provider was there for me, even though she didn't have the answers. And so I think I like the idea of doing that for someone else. And then the dean of my medical school always says this, and he says it like the same way every time since I was a junior in college. So like we're talking almost 6 years now, that I've heard him say this to people: if you like science and you like people, there is no better career. But like, it's completely true, and that's like sort of the epitome of why I got into medicine.
You like science and you like people.
Exactly.
So then, how old were you when your dad got in the accident? Like, how young?
I just turned 6.
Okay, so you were like super young and impressionable, and then oh my gosh, and then so come to high school. I mean, you were thinking about medicine as a career for a long time.
Yeah, and it's funny because people, like, everyone sort of comes to it in their own way. Like, I had a friend who, he's in his 30s and he started with us and he had a whole career before. And I, when I first met him, we were like at a bar at a happy hour for our orientation for med school. And I was like, oh, so what did you do before? And he was like, oh, I was a banker. And I thought he said a baker. And I'm like asking him all these questions. I'm like, oh, like, do you make cakes? Like all this stuff. And he like went along with it. And then later on, I found out that he was like in finance. And I was like, what did you think I was talking about? Yeah, and there's some people who like their parents are doctors, and so it's just like some of them even fight against it. And they're like, I'm not going to do this, and then you sort of find your way back. So yeah, that's my story.
I feel like I know a few of those. I'm not going to be a doctor like my parents, and then
yeah,
a few years out of college, they're like, all right, I'm going to med school. Yeah, some people, I guess, it's just inevitable. It's in your blood.
Yeah, and I think there's so many different ways that you can help people. And I think it's awesome that everyone sort of finds their own. I think especially now we have a physician shortage, which I'm sure will come back up later in the conversation. But all of these allied health professions, PAs, nurse practitioners, all that stuff are so important. There's so many people out there who are so qualified to be healthcare professionals. And there's only so many medical school spots. There's only so many residency spots. And I think it just sometimes it's a little bit where I'm like, I just don't understand. Like all these people want to help people. So just know that even if medicine isn't the way that's right for you to help people, there are so many incredible ways to do that. And even outside of healthcare, obviously, but if you want to do it from more of like a hands-on way.
I love that. Okay, so you started talking a little bit about how family practice is like the perfect way for you to talk about like or to care for more than like for the way our environment like affects our health. Tell me more about that. I'm like, tell me everything.
Yeah, so I think I was first sort of introduced to that concept when I was in my sophomore year of college. I had an incredible professor who's became one of, well, I guess now she's one of my colleagues, but continued to teach me through medical school is a large part of the reason why I chose the school that I chose. Dr. Bonnie Coyle, I know she's not listening to this, but I'll send it to her someday and shout her out. But she was my intro to public health professor, also a doctor at St. Luke's. She's a family doc, and she specifically focuses on preventative medicine. So looking at ways that you can use lifestyle to improve health. So through eating, sleep, movement, all of those things. And she was the first person to sort of teach me about connections between health status and education status, health status and zip code, and all of these things that we sort of call the social determinants of health. And I was so fascinated by that you could grow up with a different skin color or grow up in a different neighborhood, and it could completely affect your health down the line. And even like this, there was a big study called the ACEs study where it talked about adverse childhood events. And so obviously I had an adverse childhood event. And so I always kind of connected to that. Obviously there's people with ACEs scores that are double digits and have all kinds of, traumatic experiences in their past, but just the idea that things that can happen in your life can shape your health that have absolutely nothing to do with your body or your genetics. So I think it permeates through all of medicine, but a lot of the time family medicine, I just think you have the most time to sort of dig into those things. Yeah.
Totally. Yeah. Well, Sisu's Go is also in family medicine, and she's like just
Yay!
shouting out. She loves being in it. We actually got a question. I haven't used this question feature yet, so I'm like excited to see how it goes. If I tap it, can you see it? Ooh, yes. So Rachel said, how have you handled bias against fat people throughout your journey through med school?
Hey, that's a loaded
We're diving in, Marlee. Are you ready?
Oh, I wish I could say that. I like how it's not like have you, it's how have you. So let's just start there. Like, yes, there is fat bias in medical school. There's fat bias in life. So medicine is no exception. And I think also the fact that sometimes it can be very interweaved into medical conditions that you're having, or at least that's the perception. I think you can sort of go look at that from two different sides. But either way, it definitely gets lumped in. And so I think, like, especially to me, not to call out any particular field, but like I saw some of the most fat bias in OBGYN, like obstetrics and gynecology, especially with pregnant women, because it really does it affects a lot of things. It makes it harder to do ultrasounds. It makes it harder to do pelvic exams. It usually can put the baby, more at risk for various reasons. And so I know that there's this dynamic where it feels like there's this being that didn't have a choice in the matter and is now being affected by this other person's health status. But I think most people here watching know that talking about being a certain size or weight or body composition and calling that a choice is like kind of invalidating a lot of people's experiences. And yeah, so Rachel just said she experienced that with her pregnancies. And so, yeah, that was something where I don't know if I can say necessarily how I worked through it. I think I tried my best when I saw that patients were being paid less attention to. I noticed that providers would go into the room less often, or like that. I tried to sort of make up for that. I think another thing is just like talking about it and bringing it up more, even in spaces where patients aren't involved, more in the learning environment, because for the most part, it's a very like silent bias. People don't like to talk about it. And so I always think of the quote from Shrill, where it's like, she says something like, "Oh, you always talk about the obesity epidemic. Like I'm the obesity epidemic. Like I'm like right in front of you, like saying, yeah." And so I think throughout my journey to medical school, I sort of was constantly fighting fat bias and found myself to be pretty much the only fat person in most rooms, especially like of my direct peers. I think a little different, but I think if you look, and I'm sure if you do the stats that there are more fat doctors, because it's just obviously people are spread out, but I think probably people tend to gain weight further into their career, but I think it probably, they get filled, like bigger people get filtered out ahead of time, and then through life changes and whatever, you may put on weight, but it's almost this mentality of like, you forget, you still feel like you're in that sort of crowd of people who's like looking at people from the outside in. So I think there's also a lot of internalized fat phobia within the medical community, which is a little scary, but that's why I'm here working on it. But there are some really cool workarounds also that I have learned, so that it doesn't feel as much like, oh, it's harder or requires extra effort, because that, even if it's just subconsciously, can obviously affect people. So like when you're doing a speculum exam, which is like when you're looking at a woman's cervix, which is like the connection between her vagina and her uterus, you can actually take a condom and put it over the speculum, and then you cut the closed end of the condom, and it sort of helps push all of the tissue to the side so you can see better. I saw a surgeon who, like, he would get really sweaty in all of his protective equipment that you have to wear. And he had this cool like ice pack suit thing that he would wear so that he wouldn't get overheated. And I think actually, while I'm on that note, that's another thing. A huge piece of fat bias is like having protective equipment, or just equipment in general that doesn't fit you, is a huge thing. And that's definitely something I'm, especially in this current crisis, like there are so many times that I can think of when I wore the gown that we're supposed to wear for patients that you're on contact precautions with, that like the whole back was just open. And before it was like, okay, that's not that big of a deal. But now that I'm thinking about it, like it is a big deal, and it doesn't just affect, but it affects other patients. And so, make sure your healthcare providers have PPE that fits.
Yeah, seriously. I love that you said that it's like a silent bias, because it's funny, and that you said also that you think it really starts in med school, like even before, and in places where patients can't even see, right? Like I think that that's really an important thing to bring up, because lots of times, I mean, I don't work in medicine, obviously. I work in fashion, but it's the same kind of idea, right? Where when we talk, when we're asking all these brands and all of and the fashion industry at large, like, why are you not serving plus size women when they make up 2/3 of the American population? Like, why not? And a lot of them are pointing to, it was never taught in design schools. Design schools don't even have plus size mannequins, which is a similar thing, right? You can't, how are you supposed to be a doctor when you don't have PPE that fits? How are you supposed to design for a plus size body if you've never even had a mannequin to wear, like a dress form to work on? You know, I feel like it's very parallel in that way.
Totally. And I just saw somebody said med school having white coats and t-shirts, people larger than a size medium. So that's actually something that I wanted to talk about and sort of forgot, was that another time that I saw it happen a lot was, whenever there were orders for anything, the sizes, usually they would have a large in there, maybe an XL, but I used to just like not, if it wasn't a required item, I would just be like, all right, I guess I'm not getting that sweatshirt or that t-shirt. But for the required things, you can't do that. So I started writing them and being like, hey, can you see if the company has a bigger size? And they always do. And so now I've just sort of gotten over that. And sometimes they know ahead of time, which is very nice. But yeah, sometimes I will just be like, hey, like I'm a 2X. Can you order that in that size?
Yeah. Were you afraid of speaking up about that ever?
Yeah, like even for graduation this year, for the like caps and gowns, I remember, because for college we tried them on. And so for this one, because of everything that's happened, they were just mailing them to us. And I had asked ahead of time, and it feels uncomfortable you just feel like, first of all, people are making, extra concessions for you, but really it's the other way around. And so I think navigating that and kind of trying to remind yourself that that's not, the case is tough. But once you sort of get past that, I was just like, hey, I just want to confirm that this will fit me, because it says it's just by height. And I was like, not the same size as everyone else who's 5'7". So I just really want to clarify. And they were like, yes, it's fine. It's fine. And then I actually got an email that went out when they had to start shipping them out, that they used a different company, and they were like, oh, these aren't as wide as the ones that we normally use. And so if you're above this weight for this height or whatever, you need like tell if they need size. And so we did it. But I think that's taken time for me to get more and more comfortable with, because at the end of the day, all of these sizes that are on the clothes and all these things, they're just numbers, and my body is, and everyone can see it. And there's no reason to feel like saying, oh, I need this shirt in a bigger size. Like, it's very clear what my body looks like. Doesn't really matter what size clothing's going on it. So work those things, but definitely like even someone was talking about getting fitted for our white coats for residency, and I have to think to myself, like, is there going to be a white coat that fits me, or are they going to have to order it from somewhere special? Am I going to have to deal with that? Like, how is that going to work? So those are just things that other people just don't think about, because they just don't have to.
They're it's that thin privilege. Do you think that I mean, I don't know, maybe I'm like really jumping into this too far, but thinking about like the PPE not fitting, and it sounds like it's not just you, right? Like you've been around other people who have a hard time fitting in to their PPE.
So specifically, I would say there's a higher proportion of plus size men and women, people in not as physicians, but like a lot of the support staff. And people need to be protected just like we do. And so I think there's multiple biases at work there. But I think that's really important. And also,
do you think that there's a little bit of a hierarchical issue behind the PPE fit problems?
Yeah, I don't think it originated that way. I think it sort of just happens because in general, I talked about those social determinants of health. I think people that are coming from certain socioeconomic backgrounds maybe have trouble achieving certain levels of education, which lead to the health problems, and then it sort of can spiral. And so you'll see that people that are ending up in some of like the janitorial staff, like environmental services, the people working in the cafeteria, those people you may like, because for so much of my life, I grew up in a very privileged, sheltered kind of lifestyle, and my family was fat, but like no one was fat. Like there were one or two people, but for the most part, like at my college, like, I was pretty much the fattest person there, and that's always sort of how I experienced things. And I was like, why are they saying that like 60% of people are this, like me and all this stuff? And like, where are they? And I think that's why is that I just was sort of in certain populations where there are either people have more resources where they, have access to fresher, foods and produce, and they're not eating a lot of fast food or things like that. But there's so many reasons.
So many. And I just, it felt like, it struck me, sorry if the wind is loud, I hope it's not.
Mm.
But it struck me that, you mentioned that because it feels a little bit like, and I could be like very much reading into this, but it feels a little bit like your fat body is not really worth being protected. Like that's kind of,
Yeah. I mean,
right?
they may not realize that.
Of course.
That's ultimately the message that's coming across.
Yeah. It's like saying, well, some bodies are worth being protected, but not yours.
Yeah.
Which feels really crappy.
Yeah.
I mean, feel pretty crappy to say.
Especially in a field where, supposedly people's health and safety is of the utmost concern. And so I think that's when it gets kind of tricky, because then you start to sort of second guess yourself and you're like, well, these are really caring people. And so I don't want them to think that I'm not grateful for the position that I'm in or for, have given me. But at the same time, it's not safe. Like straight up, like my mask isn't covering.
It's not safe and it's not fair.
Yeah. Yeah.
Yeah. I love this. Here comes the Jameson. By the way, great handle. Thank God for Fat Camp friends. Am I right?
We met at Fat Camp over 10 years ago. She's one of my bestest friends.
That's amazing. I feel like I've heard so few positive outcomes from Fat Camp. So glad you left with a great friend.
Yeah, I have a couple Fat Camp friends that we stay in touch with. I think for me, I mean, we could have a whole nother session about Fat Camp for sure. But
maybe that's next Wednesday's wind down.
I think for me, it was almost completely self-driven, whereas a lot of other people that I met that went there, that was not the case. And so I think that shaped the experience a little bit. But yeah, I think there's definitely a decent silver lining there.
Yeah, absolutely. And the Sisu's Go said, this has been my biggest struggle with COVID testing is just well-fitting PPE.
Yeah.
That struggle seems very real and scary. And I know also that there's a shortage of PPE in general, right? So if you're making efforts to conserve PPE, I mean, it just seems like odds are stacked against a fat doctor or nurse or,
That is really nice. This is kind of weird, but in general, the larger sizes, like relative to the number of people, like you never run out of the 3X scrubs because there's not that many people in the hospital that wear them. So probably in general, although if they're just using all the PPE, then they're going to use the big PPE too. But for the most part, like you usually, Jess just reminded me about, I don't know if she meant the big or small, but I led in operating in the trauma bay. You're supposed to wear lead for like when they're doing x-rays. For interventional radiology, you wear lead during those procedures, and it doesn't really fit me, and that's dangerous. She said,
wow. Oh my gosh, Jess, I was deaf radiated.
Yeah. So I just started, like, there's a line behind which you're supposed to be okay if you don't wear the lead, and so instead of, like, I would just walk behind that line, but that's scary. That like doesn't fit. And I remember it on myself. I did all kinds of janky stuff, but
so the lead, are you talking about like basically kind of like that bib that we wear at the dentist's office?
Yeah, it's like kind of whole body. It looks like an apron kind of, but it like has around your your circumference. And so that's, I mean, like the ones that go on your neck that are supposed to protect your thyroid, that's usually okay, but I forgot about that. So thank you for mentioning it, Jess, because that's like probably one of the scariest of all, especially if you're like a woman and you're worried about, having babies and that kind of stuff. So yeah.
And Jess was mocked by a surgeon for it not fitting.
That's not cool. I have to say, I have gotten a ton of overt sort of fat phobic comments or things. I think honestly, probably this might sound kind of odd, but I would even not be surprised if I get less than Jess because I'm bigger than Jess. I think sometimes it's like, like they have to really walk on eggshells. And I think my whole life I've struggled with that and I've like people, like there's that whole TikTok trend that went around for a while that was like, oh, the fat melting off my body when someone says you're not fat. Like I've been fat for a really long time and like it's always been okay. And so I've never really liked when people didn't acknowledge it. Um, and so, yeah, okay, someone just said surgeons are the most fat phobic. So I will say, like, the places where the body is most exposed and people are the most vulnerable, it's where it comes out the most, I think.
Yeah.
Part of it. It may or may not actually be the people. Sometimes it's the context, and it just allows people to think that it's appropriate because someone's body is sort of on display, although in appropriate settings it should not be on display. Only the parts that you're working on should be out, and all of that. But I think sometimes, and the person's, asleep a lot of the time, I think people think that they can say and do things that they obviously should not be doing.
Yeah. Oh my gosh. Okay, so I have a few questions. One that feels relevant, but it's not. I'm watching Scrubs right now,
Mm-hmm.
And I've heard that it's like fairly close to reality compared to some others.
But it's definitely accurate than like Grey's.
Yeah, but so I've heard that, or from Scrubs, surgery can be kind of a boys' club. Is that true? Is that part of the fat phobia?
Yeah. I mean, medicine is a boys' club, although at this point, medical school classes are entering 50 or more percent of women. But even still, I think that, like we talked about hierarchy a little, usually people higher up in the hierarchy are male, although that is changing, which is awesome. But I think that's definitely part of it, is just in general. And then, surgery for sure. OB is sort of an exception. There are obviously a lot of women that go into that field, but
yeah. And I was wondering if that, I know that, there's a lot of women in that field, and I'm wondering if are a lot of the women the ones that are the problem with the fat phobia in that.
Yeah, no, I don't know if I can say like, oh, it comes from them more or not, because there just were so many more women around.
Sure.
But it's certainly,
it just feels like a woman-on-woman crime to me.
Yeah. Like, I even had someone who like had lost a lot of weight, and like they referred to, I forget if it was you guys or Dia and Co, or who, someone posted about words that people liked referring to their bodies and didn't like, and fluffy came
that was us. Yeah.
Number one, like, and she would call patients fluffy, and it like, and that was the first time I had ever heard that, and it irked me. And so I entered that, in that whole thing, and then I saw that everyone else said it too, and I was like, oh my God, like I didn't know this was a thing. But yeah, that
I love when you realize like you're not the only fat girl who's hated XYZ, hated the word fluffy, hated whatever. It's just like the most gratifying feeling.
Most part, people do feel similarly about certain words, but also like interesting to see how differently people feel. Like, for example, a big word that came up is like obese or obesity, and I have a lot of mixed feelings, but I think because that was brought up so much through medical school, I have this like almost defensive spot for it that's not cool, and I'm like realizing that I should examine that, because I don't think it's really how I feel. But I think that's one of those things where I'm like, well, like it's a technical thing, but it's like it's already has such a connotation that it doesn't really matter.
You've been a bit desensitized yourself.
Yeah, for sure. Yeah, and it's like also trying to find the right language and the right words. Like, I don't even know if all the way through medical school I like was at a point where I was referring to myself or other people that often as fat. Like, even that was a thing where I never really had a problem with it, but I know other people definitely did. And so even that's something that I'm still working on, and also trying to figure out like how to talk to other people who aren't within medicine, and like explain to them that yes, you need to talk to each person, but like that's not a bad word, and that's okay.
Right.
Because definitely something where people like, I feel like that's part of where obese came from, almost like a more politically correct way to refer. And I think that sort of reclaiming that word fat, I think a lot of people in the medical field don't know that.
Yeah, absolutely. Yeah. I mean, I think that it even, I think, just even within friend groups, right? It's like my fat friends are like chill with it, but my thinner friends aren't chill with me calling myself that, or a friend calling herself that, so absolutely, I think that it's still niche, reclaiming it, but it hopefully, hopefully, right, with more than 50% of women in med school, and with Lizzo becoming queen of the world,
He is
the future is female, And hopefully we can get some, fat representation to help change things a bit. That it's so interesting too to hear from your perspective. And what I was really wanting to know, I constantly am seeing in this, plus size community, I'm constantly seeing women complaining about the way that a doctor treated them. Like, for instance, this one influencer who is fantastic. Oh, honey is her handle. I don't know if you follow her. She's great. Her name's Sydney. Highly recommend. But she just posted, I think yesterday, about how she was having some abdominal pain and went into, she thought that, I think it was like period related kind of a thing. So she went into the doctor, and the first thing that she said as soon as she sat down was, I looked at your chart and I saw that you have a history of eating disorders, but I wanted to know if you were considering losing weight because I have this great surgery and this incredible pill that basically gives you anorexia. So it's awesome. Like,
but it's just still jarring.
It's so jarring. Oh my God. Like, just reading that, I was like, I feel so uncomfortable just reading this. And to start it off with, I know you have a history with an eating disorder, but it's like, this person is clearly in recovery, have some sensitivity. But anyways, my point is, I guess,
just enough about, so that's a separate, we get like one lecture on eating disorders in our psych block, but that's something that is niche within medicine and shouldn't be, because it's common enough that it really, really shouldn't be. And even if it weren't common, it affects people strongly enough that it should be.
Right. And judging, someone based on their size instead of, the fact that their chart says eating disorder. It's like, hello, you can be fat and have eating disorder.
Right.
Obviously. Right. But anyways, I guess my point, I didn't mean to take us down a dark path. But then I'm like, what are the red flags? Like, how can we find the right doctors who are going to treat us well? And how can we advocate for ourselves? Like, how can we stand up for ourselves when a doctor says something like that? How can we fight back and say, like, I'm not okay with you treating me this way? Like, how do we feel empowered to do that?
Yeah. So I have a lot of personal experience, really. And so this is, it's kind of interesting to sort of be a little bit on both sides of this. But first, I just kind of want to say, like, I just want to validate anyone who has had an experience like that. Like, I'm going to try not to get too emotional. I have avoided seeking care. I've cried in a doctor's office. I've gone home and eaten more because of what someone has said. Okay, take a second. But so, like, that stuff is so real, happens to everyone, happened to me. I think even as I was pursuing a medical career. So just, I see you. But I think that, thanks. I think a couple things that I have found helpful. One, either you or someone else can call ahead and talk to either the office staff or the doctor and say, like, hey, me or whoever this person is really doesn't feel comfortable discussing their weight. I don't want to be weighed. And I will say, you might want to do it a couple times. There was an experience where there was a phone call that was made, but still the message didn't get across. So I think, hopefully that won't happen to you, but if it does, don't give up. But yeah, that's one thing that I would suggest. And I think just like being upfront about it. So for me, like, I one time went to a doctor who, I don't think he was a bariatric surgeon, but it was like a weight loss practice. And so they had like surgical and non-surgical pathways. And I we again can have a whole nother conversation on surgery, but I knew that I wanted to go the non-surgical route. And basically one of the first things that they said when I got there was, I just want you to know that your BMI puts you in a category where you qualify for this. And so we started talking about it, and I was just like, I have absolutely no interest in this. I do not want to talk about it anymore. And I do not want you to bring it up with me again. Was I quite that eloquent and composed? Probably not. But it was received, and it did never come up again. And I think with my primary care provider, I just sort of have had conversations over time where it was just like, hey, like, I'm fat, I know I'm fat, like, we're all clear on that. I'm clear that if I lost weight, there are pieces of my life, of certain conditions that I have, of the way that my body feels, physically, that might improve. But I also know that I've tried to do that so many times in so many ways that were so bad for my quality of life in other ways. And so I'm not doing that again. And so let's talk about what, is important to me each time and support me when I want certain things. But, I know what's going on. You know what's going on. There's no need to like every time sit down and be like, we have a great relationship. And I hope that, other people can find that. It certainly wasn't like she advertised herself as like, oh, I'm a fat friendly doctor and this whole thing.
Sure.
There definitely are some, I think, as far as that goes. I think we were trying to talk red flags, so I apologize. I'm going more the other direction.
You're doing an amazing
job. But I think, doing as much like Google searching and stuff like that. I've done that too for like therapists. I really wanted to talk to someone about finding ways to modify some of my habits and relationship with food in general, but like without villainizing foods, without, shaming my body, all of these things. And so I like looked people up very specifically for that and was able to find someone and talk to them about it ahead of time and make sure that we were on the same page. But sometimes you don't have that luxury. And so you kind of just have to talk about it. And that sucks sometimes. Like those conversations are really hard. But they're worth it from my experience.
Yeah. And I love these comments. If we could all just have Dr. Marlee, because
college roommate.
Oh, but I mean, I don't even, hello, I'm meeting you right now for the first time. And I'm like, can I have Dr. Marlee? Because I think that there's something about having a doctor who kind of just like, just from one look, like you get me, you know what I mean? Like you get me, you get my struggle. And, I just think that would be incredible because most of the time I've gone to the doctor's office, it's been with a very tall, thin white man who has, told me, of course, me when I was much smaller, given me a lecture on weight, and it's like, well, you don't know that I literally all day, every day I'm running a summer camp and like running, you know what I mean? You have no idea about anything that I'm up to, and you're just so quick to judge. And I know that my experience is totally, like you said, it's happened to literally everyone, and I've been lucky enough to avoid most of it. But
widely in their size, weight, body composition, health status, activity level. Like, I mean, I've heard it from people so far all across the spectrum because BMI got so hammered in for so long. It really, I mean, and especially what you brought up about being younger. I mean, that stuff is like so scarring from being younger and talking about weight. Like I'm sure I'm one of many people who like first experience with something like Weight Watchers was at age like 10 or 11. And like that kind of stuff is just, when I think about it. Ooh.
Well, yeah. And I mean, Fat Camp with Here Comes the Jameson, right? Sorry, I just love that handle so much. Oh my gosh. Okay, we have so many fantastic comments. I want to read them because I don't want to lose them. So Ricky Feig says she agrees to discuss everything up front. Explain you're not unaware of your weight and the impact it has on your health. I mean, I think all of us fat folks are aware of of our size. We all have mirrors. And if you want to support info about weight loss, that you, the patient, will be the one that brings it up. I love that. That's a really great tip. Curly Cutie Cat Lady, fantastic handle, by the way.
Everyone follow her on TikTok. She's awesome.
I will, because all of those things I like. I had a doctor that mentioned my weight every visit, regardless of why it was the worst. So I think that, like Ricky said and like Marlee said, mentioning like I do not need to talk about this is helpful, because I think lots of us don't feel empowered to speak out against someone in a position of authority like a doctor.
But at the end of the day, and this I think gets overlooked a lot, like it's very much a two-way street, and medicine, although it's an art, it's a science, it's all these things, it's a service field. And at the end of the day, we're here to serve our patients. And so ultimately, the number one thing that you want is for that person to come back.
Right.
And I know so many people, I myself have had this experience where you write someone off because of that experience. And it hurts everyone in that situation because that person doesn't know that they did the wrong thing. They're going to do it to other people. You now are not the care that you need to serve. So, yeah, but that said, if you have a doctor that it's not working with, get a new doctor. It's okay. But
Yeah.
also,
But no, I love that. I didn't even consider the fact that if you don't point it out, they're just going to do that to more
mm-hmm,
patients.
mm-hmm.
So you have to speak up, even if, like you said, even if it's not the right doctor for you and you need to switch doctors. Speaking out, I think who knows? I mean, think of your fat friend that you might be helping.
Yeah, yeah, totally. Your kids, I mean, just anyone that's, yeah, going, your fat, not friend, just a fat person off the street.
Right.
Also, I'm sure, I know this was something that I wanted to bring up, is like people who are considering going into the healthcare field or are currently in part of that process, but are struggling with the idea or the process because of their size or experiences that they've had. Like, please, please, please come help me in the fight. Not just because I'm desperate and need help. It's very rewarding, I promise. But like, if you can't do it for yourself, like do it for people so that they can have someone who looks like them and understands them, because this problem's never going to change if we don't have more fat doctors and healthcare providers to talk about it. Because we can tell medical professionals all we want to learn more about it and understand it, but it's not going to change it unless someone who understands things from the inside and the outside is a part of those discussions. So
Absolutely. No, I love that. I love that. Oh my gosh. So if anyone's watching and they're considering a career in medicine, can they DM you?
yes. Oh my gosh. Please do not hesitate to reach out to me. Absolutely. Whether you're fat, not fat, anything, happy to help or talk. I think I just made my Instagram public, so that should make things easier as well.
Okay, yeah. I think that was the issue why I couldn't just pop you right into the live.
Uh,
Maybe that could have been it. I'm not positive.
yeah.
We're learning. But also you're super rad, and I think making your profile public is awesome just for representation's sake. I want to see badass fat babes killing it, having incredible careers, especially in fields like medicine where there is such an extreme bias. So thanks for that. Thank you.
I got after, thank you for your feature, because after that, I had gotten some follows and some messages from people who, said that they're inspired to just see the representation, or that they are considering a career, and that it sort of helped them remember that they can do that. And so, yeah, I'm still very much figuring all this out and navigating how to tackle fat bias in medicine, how to be a fat person in medicine, all of these things. And so I think for me, the first step is just starting to have the conversations. Like, one thing that was really disappointing in my residency search was that every single program that I spoke with, even the most progressive programs that have amazing resources, incredible faculty, I asked them about like health at every size training, if they have any faculty members that I could mentor me or anything like that. And honestly, no one really had any information for me.
Wow.
In a field as progressive as family medicine, I was very disappointed. That said, a couple things. One, I only interviewed in sort of the Northeast. And so I'm sure that there's some more progressive stuff happening other places as well. But and then the other thing is that the programs that were at the top of my list that I chose were very much like, oh, we will totally support you in that. And please have those conversations. And we want you here because you do bring diversity. And so I definitely want that to be a part of my journey as a developing physician. But I've realized that for the most part, I'm going to kind of have to just like make it up as I go, because there's definitely and if there's doctors out here that are doing this stuff, like, please talk to me. I know there's an awesome doctor in Australia that I've been following who has been doing some great body positive stuff, but there's definitely not, like, there was a post, I think it was Your Fat Friend. I'm trying to remember. There's one where they were trying to link people with fat friendly providers, and it was mostly patients. Like, I wrote on it, was like, hi, I'm going to be a doctor. Like, please, mentors, like, find me. And I mean, nobody's found me yet. So definitely
Oh man. I would love to Yeah, I would love to, like, maybe we can get a list together of like fat friendly doctors, mentors, just health at every size individuals. And I think also in addition to that, like everyone who's been a patient and had a really positive experience with the doctor who has, you know, not treated them like just a fat body, maybe we can also just pile them all into one place so we can just give some people this awesome resource. But if you see anything, I mean, let me know how I can help, basically.
Thank you. Okay. We will definitely talk about it. We'll figure it out.
Yeah, let's give the people the resources. Also, I have to say, this comment from between two stethoscopes is so sweet. She wants you to move back after residency and be her PCP.
I most likely, I didn't speak too soon, but I know most people watching this who know me probably would like to hear me say that after my 3 years, I'm going to Pittsburgh for residency. And so I think that's like around 5 hours away from home, and I've never been more than 45 minutes away from home for an extended period of time. So my wings, boyfriend and I are moving out and moving in together. So a lot of changes happening, but yeah, I think most of them would like to hear me say that I will be there for 3 years and then I will be back, and that is definitely the intention. Oh God, my mom's commenting.
Most likely, Marlee.
But you never know where life will take you. But I will most likely be back in the area.
I love it.
And being in the Philly area too.
I love it. She wants a promise. It's true. And New X Heights asked, is this chat going to be archived in some form that's shareable? Yes. I know Instagram recently released the feature where I can just plop this on IGTV. That is the plan. If it doesn't work, I'm still going to find a way to get this on YouTube. I agree.
Whatever we have to do.
Yeah, we're going to have to just come back and have the same conversation round two if it doesn't, work.
And I'll like cry at the exact same time. It'll be perfect.
Oh yeah, if there's no tears, I'm gonna be pissed. I love it. I'm in Philly. Yay! Oh my gosh, see you soon. Go. You guys should totally connect. I think that would be awesome.
Yes.
So cool. Okay, Instagram is definitely going to kick us off in about 7 minutes, but I want to make sure if anyone else has any other questions for Marlee, bring them in. Let's fit them in. But I wanted to know just also, okay, if someone is thinking, do I want to be in medicine, or is it going to be too scary because of my body? What would you say to them?
So first of all, medicine is scary for everybody. Like, it's a long road. It's a hard road. I often tell people, like, you should really only do this if you can't see yourself doing anything else. If there's something else that you feel like you would be totally happy, totally fulfilled, like, go do that thing, because this, like, you have to be in it. Not to say that you can't have a life. By all means, that's the biggest lesson that I learned in medical school, is how, like, doctors are people. And we have to, take care of ourselves before we can take care of anyone else. But I think that's something important to think about, is just in general, like, it's not something to take lightly. That said, I mean, of course I want to just say, oh, please, like, don't hesitate, and just do it. And I think for a lot of my life, I don't think I realized how much I was sort of up against pursuing this journey. I just sort of did it because it was what I wanted to do. But I think now I even see more value. And like I said before, like, if you can't do it for yourself, think about your sibling or your child or your friend or your own experiences, and think about how those would have been different if someone like you was, a healthcare provider for you or for that person. And maybe use that as motivation. And also, I think the more of us that are there, the more support you're going to have. So, we kind of just have to, like, make the trend go and get connected and lift each other up and support people. So I think,
yes.
Yeah, that's my,
and make Marlee your, what's the equivalent of drag mother in the medicine world? Mentor.
Mentor. Although I think we should think of something better than that. We'll work
Maybe
on
just
it.
drag mother.
Yeah, whatever.
And I don't know why I haven't asked you about this. Tell me how graduation went. How did it go? How was this virtual graduation? I want to know everything.
I thought it was pretty good, even better than I expected. And from what I heard, like some schools were like not really even going to do anything. So I'm pretty happy with what Temple did. But I think one part that was really cool was that it was on Zoom, so everybody, like, you could see everyone on the screen in their caps and gowns. So just the med students were on like that, and then everyone else could live stream it from like YouTube or Facebook. And it was really cool because, like, at first I felt really stupid sitting around in my cap and gown, and then I saw everyone else doing it. I was like, this is cute. And they showed our pictures, and yeah, it was really, really nice. And then some of my family members and friends, we did a Zoom afterwards to toast. So thank you to everyone that was there for that. But yeah, it turned out a lot better than I expected. I think the biggest thing is, like, more than graduation, like, we just all want to like see each other like one last time. We didn't have so much like closure, especially my specific program. There's 30 of us and we're all very close. And so I think that's been really tough, more than anything, but we will plan something. We're working on it. We have a big holiday party every year. Everyone's going to try to get to that, and crash it. So we'll figure it out. But I think in general, I've tried really hard to have perspective with this whole thing. Like, I'm healthy, I'm in a safe, comfortable place, all those things. But yeah, it's nice when you do some of those little special things to make it a little bit better. I think at first I didn't think having the cap and gown would make as much of a difference, but it did. It definitely was for. And my mom made this like really cute setup. So thanks, Mom. She makes everything better.
She's listening right now. She knows. And I wanted to also, oh my gosh, now I'm forgetting what I was going to say. Oh, is anyone in your family, mom, otherwise, anxious about you being thrown into this medical world in the midst of a pandemic?
Oh, yes. For sure. I'm sure she can comment for herself. But yeah, I mean, she is worried. Luckily, Pittsburgh is actually in a little bit of a better position than more like Eastern Pennsylvania and obviously New York and New Jersey. So I am excited that I'm going somewhere that's like a little bit calmer in that respect.
Yes.
Yeah. But yeah, I mean, they're more nervous than I am just because I'm kind of like, this is what I signed up for. Like, right. I'm here for it. So, I mean, I'm not like trying to get sick, but that's my sister. She said she's terrified. Also, shout out to my sister. I love her so much. She's taught me so much about fat bias in medicine.
Oh, that's fantastic. I am sister. How has she taught you? Is she also in medicine, or is she?
No. She's younger than me. She's an artist. She's incredible. I'll post some of her stuff on my story so you guys can see. But she taught me about like sort of finding some of those workarounds, like calling ahead and those kinds of things. And just like having someone else who's gone through the same kind of stuff as you and is like, yo, this sucks when people do this. And yeah, she's just had so many doctors who like, she's had a lot of back problems, and she's had doctors who, you know, she'll go for back pain and they're just talking about weight, and it's like, okay, great, but like, I can't even move to try to lose weight if my back hurts like this. So we need to talk about something else. And that's the thing, is people sometimes are not realizing that like, you can't even solve that problem until you fix these other things. So yeah,
I love that. So your sister has helped you be your biggest advocate.
For sure. And
that's so cool. And she's also plus size.
Yes.
I'm guessing. Awesome. So you guys that's so great that you have like a built-in support system in your family, like with that. That's really special.
And my mom has come a really long way. Not that she wasn't always great, but I think just she is plus size. I guess it probably depends by like whose standards, but she's like a small fat. And so I think learning from us has also been an experience for her, because she has experienced plenty of fat bias over her life, but she hasn't quite been in a situation where it's like, you know, she can't fit into a chair, or she can't, you know, doesn't feel comfortable on a ride, you know, those kinds of things she hasn't experienced. So I think she's been awesome and very supportive as well.
I love that. And your sister says, I hate doctors, and my sister is a doctor. She's going to change my mind. That is so fantastic. Oh, well, okay. Instagram's going to kick us off in about 30 seconds. So I want to just thank you so much, Marlee, for taking the time to chat with us. This was so fantastic. And I will do everything in my power to make sure this doesn't disappear in 24 hours. You can share it. But thank you seriously so much. And congrats and good luck. I'm so excited for your journey.
I will keep you guys posted. Thank you. Thank you, everyone who's tuned in at any point, anyone who's going to watch later. And feel free to reach out.
All right. DM Marlee if you need to.
Bye.
Bye.